Good afternoon, good afternoon, good afternoon, divas. Hi, everyone. Can y'all hear me okay? Okay. How is everybody's womb today? um, for those who may be joining for the first time, my name is Zaire. I am a RN, herbalist, womb wellness specialist, prenatal specialist, a whole bunch of other stuff. And pretty much what we're going to talk about today is the yays, nays, hows, and whys of vaginal steaming. It is a very new situation or new treatment, treatment modality, but there's still a lot of controversy around it. So what I wanted to do was take time out today and just kind of go over not so much the history of it, but how it actually works and why it actually works. Yesterday, I was not able to finish my lecture because of all the questions. So today, what we're going to do, if possible, thank you, Zaki. I'm waiting on you too, boo. We could hold all the questions to the end, and I will get to all the questions in the end, only because as we talk about this, it's going to get really it's kind of heavy, and what we're going to do, we're going to take the scenic route to getting to how and why, because I really want you to understand and have a very strong foundation as to how all the different things that plague us, how it contributes to the way we have menstruation. And then once we have that dialogue, then you'll have an understanding as to why your GYNs or OBs never was able to tell you about these things, okay? So yeah, let's get started. Oops, where'd it go? One day I'm gonna learn how to work this thing. So, okay, so no one answer these questions out loud. Just do a inventory of yourself, okay? So on a energetic spiritual level, the womb is a woman's center. She is our place of creativity, our connection to the earth, to our ancestral lineage. She holds our wounds, our past sexual experiences, and as a hollow organ, she often becomes the storage center of our deepest fears and shame, thus creating an emotional armoring. This armoring tends to produce a sense of disconnection to self, dissociative patterns, numbness, and difficulty staying present during sexual experiences, not to mention making it difficult to conceive again. And on a physical level, this often presents as difficulty conceiving, and it will oftentimes manifest as growths in the womb. Okay, so like I said, just take inventory as to how many, as to how these questions relate to your journey. Okay, now I know over time we've heard how strong energy or strong emotions tie into certain body imbalances, whether it be gut or things of that nature. So let's look at this here. And this is the energy centers, the feelings, and how they correlate to the body. What I specifically want everybody to look at is going to be the heart center, and then the old stuff or survival center. And for y'all, for those young ladies who are really into the chakras, I want you to put your chakra knowledge on top of this, okay? The heart chakra, sacral chakra, root chakra, the emotions that get trapped. Pay attention to those as we move along. For all my medical people who have an actual medical license, like if there's any other RNs, LPNs, doctors, MAs, whatever, I want y'all to put your medical knowledge aside just for a second. It's going to come back, but for now, I want you guys to kind of put that aside and just allow yourself to be open to what we're going to discuss today. Okay. So with this particular slide in the energy centers, it's important to realize that how emotional scarring affects the reproductive health of women, how it affects our heart chakra, how it's just multiple layers of emotional and spiritual and physical healing that needs to go into place to make it necessary for us to heal. Some of the things that we're going to look at today is going to be herbs and the herbal actions of these herbs, such as them being adaptogens, emmenagogues, adrenal tonics, hormone regulators, nervines, alteratives, and tonics. All right. So the first one that we're going to look at is old unresolved relationships. I'm pretty sure we all here have a relationship, whether it be with a partner, spouse, loved one, friend, family member, where they just got on your everlasting last good raw nerve, to the point where it's like, you know what, I'm gonna stop talking to you today. I'm gonna pick this back up in a couple of weeks. Or let's just say you were just done really grimy by someone in your life, and you may have actually healed from it, but you never got over it. Okay, those type of emotions sometimes will hold place in our womb. And in traditional Chinese medicine, it has been studied that when we are engaged sexually with somebody, regardless if it's same sex or different sex, that energy of that person remains in our bodies for at least 7 years. There's actual documented studies within Chinese medicine that speaks to this. So let's just do some quick math, right? So let's say you had 3 different mates in 1 year, or 3 different sexual partners. I'm not gonna give them the beauty of being called a mate. Let's just say just 3 sexual experiences with 3 different people. That's 7 years. On average, that's 7 years of their energy being trapped in your womb. Okay, so we're looking at 21 years of just having that energy in your body. Now that's just 1 year, 3 different people. 21 years. So y'all do the math. Everybody here has had sexual experiences, some more than others, but that's what you're looking at as trying to get rid of. Okay. And what happens over time is that this can actually make your womb extremely stagnant. And this will give way to things like clots, cramps, PCOS, endometriosis, as well as vaginal scarring. So let's take a second real quick just to talk about PCOS. Although PCOS is in the womb, it's actually a endocrine system imbalance because of how it affects. It is a hormonal disorder, and what happens is, in order to be diagnosed with PCOS, you have to have a couple of different things present. You have to have irregular periods, you have to have excessive androgen levels, and understand, so the androgen levels is a hormone that's produced from your ovaries. And if you see women that have like facial hair, you know, they have like almost like a beard, or they have like mustaches or chest hair, those women have a higher level of androgen and or testosterone in their body, which kind of puts them in that bracket of possibly having PCOS. More likely than not, they do have PCOS, even if it hasn't been 100% diagnosed by their practitioner. They're also going to have polycystic ovaries, which literally means they consistently have a lot of mucus, maybe polyps, cysts on their ovaries, things of that nature. Also with these women, they're going to have thyroid dysregulation. They're also going to have possible be pre-diabetic and or diabetic, sliding scale diabetic. So I just want you all to understand that this is PCOS, okay? And in order for it to be diagnosed by a physician, you have to have at least three of everything that I just named in order for them to say, yes, you do have PCOS. Okay. Endometriosis. And okay, so PCOS and endometriosis kind of go hand in hand, because a lot of times with the endometriosis, you have the tissue coming through other layers of tissue. And usually women that have this, you know, so they suffer from extreme pain. They usually have polyps or cysts on their ovaries. the mucus from the polycystic or the cysts that are on the ovaries leaks out, dries, and attaches to the different organ systems. And it can be extremely painful. They can have the pelvic pain, they can have the pain with intercourse, with bowel movements, they can have excessive bleeding. It tends to lead to infertility. And once it gets to the point where the endometriosis, or the lesions grow outside of the uterus and start attaching to your other organs like the colon or the appendix, that's considered stage 4. And usually that's when they start talking about surgery to cut all the tissue off. Okay. So childbirth. I'm pretty sure a good many of us in this room have birthed children in one form or another. Childbirth by itself is a very traumatic situation. Even if it's a beautiful birth, no interventions, no medications, you know, you had the candles, you had the right atmosphere, you had a supportive team, you had a supportive partner, you had no issues, like it could go textbook smooth. It is still a traumatic situation, mainly because you are literally taking an ancestor, or, I'm gonna say it, you're taking an ancestor from the supernatural and bringing them through into the human realm. Literally, you are taking an esoteric being and you are being the channel for this being to be born in this realm. Okay. Now that's with a good birth. That's with a good birth. You know, if you happen to have a traumatic situation where you've been in labor for 72 hours, or you had to get a C-section, or maybe the baby didn't turn correctly, or maybe you just had a crappy pregnancy, maybe you're not supported, all of that stuff, all that trauma locks into the cells. And when this happens, it's been linked to cysts, decreased sexual fulfillment, disconnection during sexual intercourse, as well as making it challenging for you to bond with your baby. And then it's like, so for those of us who've actually delivered babies or been around when a baby's born, there is a point, if you look at the mom, there's a point when she's just gone. Like she's just not here. She's not connecting. She doesn't know what's going on. And everything she keeps saying, like, oh my God, it just really happened. Did this really happen? Oh, my baby's here. Like, and that's usually the point where everybody's saying, oh, congratulations, the baby's beautiful, you did a good job, all that kind of stuff. But there's that space where she just has, like, literally the lights are on and no one's home. Okay. That particular moment is what's called a Shin disturbance in traditional Chinese medicine. And within that moment, literally what's happened is that her spirit has been displaced. So her spirit has to come back into her body. And that's why there's that blank look on her face, that, oh my God, what happened? Did this really just happen? And the same thing for the baby. Like literally the baby's been in darkness, literally in darkness for 10 months. And then all of a sudden it's just like, boom, lights are on. There's sound, there's air. What's going on? Everybody's confused. So that's why I say childbirth is a traumatic experience, because both people, both baby and mom, are traumatized during this situation, even if it's a good one. Okay. Abortions, you know, I need to change this slide. I'm gonna start changing it to surgical loss. Surgical loss and miscarriages. And regardless of how complete this particular process is, it still holds trauma. Okay. Let's say it's a situation where it was not a consensual sexual experience. That alone is going to have its own situations. But now that mom has to live with the fact that there is an entity growing inside of her, and she didn't ask or open herself up to be there. Let's say it's a situation where, you know, the mom has tried, you know, they've gone through IVF and whatnot, and for whatever reason, that particular being does not come to fruition and decides to leave early. Okay. All of that stuff holds trauma in the womb, and it manifests as scar tissue. It can manifest as fibroids. It can manifest as cysts, as well as just having an absent menstrual period for a short time, or even have an extreme bleeding over time. IUDs. I hate these things. I so hate these things. And it doesn't matter what kind of IUD it is. If it's a copper one, plastic one, it doesn't, I hate these things. And literally what happens is you have to understand that on a monthly basis, the gravity of our body is down. You know, it's down and to let out. When we use tampons or IUDs or anything like that, what happens is that that energy gets trapped and it continues going up as opposed to going down. So we're going against gravity at this point. And that trapping effect, that's what leads to like the infections, having scar tissue on your fallopian tubes, having blocked tubes, having water trapped in your tubes. And it's also even been linked to endometriosis in some cases because of all the extra hormones that is trapped there and coming out. Because remember, your body is an organism unto itself, and regardless of conceptual thoughts, it will do what it needs to do to survive, one way or another, with or without your consent. Okay. Also with that, you have like old residue, you have the heavy menses, the disruption in your hormones, because a lot of times birth control and IUDs, their whole purpose is to have you produce hormones so that it doesn't allow for the eggs to be fertilized. And what that causes over time is a thickened uterine wall, which makes your uterus, makes your uterus so thick that the sperm cannot pass through. But on the outside of that is that when you are ready to have birth, or not have birth, to get pregnant, it makes it challenging to get pregnant. Okay. All right. Sexual trauma. This is just how it is. Everybody understands that when a person has been violated sexually, that it is a traumatic experience on every level. The spirit's displaced, there's embarrassment, there's pain, there's guilt, and that's just the emotional stuff. Okay, that's not what happens when you have a person that's unwanted depositing into your body, because now not only do you have to deal with the physical the physical repercussions of this person violating you. And remember, every time you have a sexual experience, we're looking at roughly 7 years of it hanging around, lingering. Okay. But now we have to deal with the dreams, the nightmares, the emotional and spiritual displacement. All of this stuff causes vaginal dryness. It can cause irritation in the vagina. It can actually cause your womb to just literally shut down, period. Just stop working altogether. Okay. So how do we fix this? That's the biggest thing. How do we fix these things? Before I go into that, I'm going to go to the chat and just see what everybody's talking about real quick. Okay. Smudge Life it's not so Smudge Life, she says that 7 years is falling off like the credit, like your bad credit. Doesn't really work like that, but but something like that. Something like that. Doesn't necessarily just fall off. Oh, how do I slow down? Okay. PCOS. Facial hair, yes. Facial hair is the worst. Love you too, Zakisha. Yep. Okay. Okay. So going back to how do we fix these situations? So one of the things that in traditional Chinese medicine is that there is an energetic connection between every body organ. So when we have imbalances with our womb, regardless of what it is, there is a heart, spleen, and liver connection to all of these. And our job as practitioners, and not even as practitioners, but just as women, is to reclaim our womb and get ourselves together. Okay. And the reasons why we do this, the reasons why it's important, one is because it does not matter what any patriarchal situation says. We are the holder of the lineage. The fact that the entire planet has not planet, sorry, every human on this planet has come through the womb of a female, we are the holders of the DNA. We are the holders of the energy. It is us that holds it. Yes, there is a part that's played by the other person, but primarily we are the holder. Okay. Right now, we have all the eggs we're ever going to have in our entire life, right? So at one point, you, your mother, and your grandmother were all in the same body at the same time. Right now, everything that we're going through is imprinting on our eggs. And if we decide to get pregnant, or if we have a baby or whatever, part of what we're going through right now is going to imprint on them. This is how that can be proven. How many of y'all have ever had an experience, deja vu, of being in a place or talking to someone and you had no idea who they were? You've never been this place, but there was an intense, like a visceral almost reaction to being around them or being in this place. Then to only find out a couple of weeks later, maybe a year later, whatever, that, hey, that was actually, your mom's friend or family member, or, your mom went there at one point in time before you were even born. That's how all these things connect. And that's why it's important that we stop the generational curses, and how we heal our womb and take our power back. Okay. So let's look at how we're going to fix the heart. The heart's responsible for joy. Okay. When it's out of balance, there's a lack of enthusiasm, vitality, depression, there's insomnia. The function of the heart, it regulates the heart and blood vessels. Now, when this particular organ is out of balance, we're looking at having heart palpitations, insomnia, irregular heartbeats. It could be also excessive dreaming, like lucid dreaming almost, dizziness, poor memory, poor concentration. This is also where we see the shin disturbance come back into play. Okay, that lights on but no one's home type situation. The spleen, on an energetic level, it's associated with being an overthinker or a worrier. When it's out of balance, we end up having extensive mental work. Like this shows up as women, or not even women, but people who have issues going to sleep. Like when they go to sleep, they say, yeah, I'm asleep, but I can't stop my mind from racing. I can't stop thinking about what happened today, what I got to do tomorrow, what's coming up, what not. Or people who just over focus and dwell on a particular topic. Now understand, when I say this, I'm not talking about like if you have a project at work, or let's say you got a test the next day, or you're going through a situation with your family or spouse or whatever. I'm not talking about that. I'm talking about like stuff that people can't control. Like the fact that, let's say, okay, so Israel is not allowing the Taliban is destroying the oil fields. On this side of the continent, that has absolutely nothing to do with us as far as control. We have no control over that. But yet this is the person that's going to sit there and watch that in the news and just get all flustered and get all in their head about it and whatnot. Okay. What happens function-wise is that the spleen also helps us digest our food, and it's responsible for the nutritional breakdown of the foods that we eat, which helps form our blood and make our blood nutrient rich, as well as chi. So that word QI is chi. That's your energy. Okay. When these symptoms are out of balance, that's what's going to assist with being tired, having a loss of appetite, short menstrual cycles. And understand real quick, when I say menses, I'm talking about your actual bleed time. When I'm talking about menstrual cycles, I'm talking about the first day of one menstrual cycle to the first day of the next menstrual cycle. Okay, so if you ever talk to me and I ask you what's your menstrual cycle, don't tell me 5 days. It needs to be 14, 28, 32. I don't know, because I haven't seen it in 6 years. You know, it's that kind of answer. Okay. When the spleen chi is sufficient, there is an adequate production of the chi, and it changes the disharmony to harmony. Okay. It lengthens your menstrual cycle, as well as it strengthens your actual tone of your uterus. The liver. Now, we all heard about how your liver can be congested and being mad and whatnot affects your liver. So this is what that is. Anger. I'm pretty sure all of us have met that one female at work, or even that just one male at work, where they were just irate and mad all the time for no reason. Like literally, you walk in there, you say good morning, and they're like, what's good about it? Screw this, screw that, F you, F this. And you walk away saying, you know what? You need either Jesus, sex, a spliff, or a drink. All the above, but you being too much. Those people, they have liver imbalances. Okay. The function of the liver on a Western modality is to, you know, helps to store the blood, responsible for smooth flow and blood and chi throughout the body. Sorry, that was the TCM version. On a Western level, it's responsible for producing and excreting bile and helping to detoxify the blood. Okay. When this organ is out of balance, we're going to experience, not we, but the person will experience, you know, red face, super heavy menstrual cramps, irregularities, like maybe it'll stop, maybe it'll stop. They'll have super, super, super heavy periods. And when I say chest distension, they're always like huffing and puffing, you know, so they're always, you know, their chest is always puffed out. Okay. Let me see. They're also going to be symptomatic with having a lot of nausea, vomiting, a lot of gas, a lot of belching, things of that nature. I can't pronounce this. Moranike, she asks, can you regenerate the uterus when trauma and Western medicine has damaged it? Absolutely. Within reason, and we'll get to that. I'll answer that again later, but yes, you can to a certain extent. Okay, so hold on, can I get out of this? Okay, so real quick before we go on, I know that was, okay, in my head it sounded really quick, but that's the foundation of where a lot of our imbalances come from, and how on an energetic level it starts to, you know, settle into our womb. So let me ask you ladies, does that make sense? I don't want to go further if that part doesn't make sense. Okay. Okay. All right. So we're good. All right. So now for the fun part. Not how, but what practices can we actually do to restore our womb? Okay. Let's see what we got going on here. All right. So very first important thing, stop allowing unworthy people into your body. Okay. And I am no exception to this rule. I've seen some people throughout my journey in this world that was way too cute. They, you know, said the right thing, you know, talked the good game, and I gave it up to them only to feel like it wasn't worth it. You know what I'm saying? So I allowed the lower vibration, or I allowed the physical to interrupt my life. And because of that, I've had miscarriages. Because of that, I've had yeast infections, you know, all kinds of stuff. So stop allowing people that are unworthy into your body. And yes, unfortunately, sometimes we don't find out they're unworthy until after the fact, but do your best to kind of discern the difference. Abdominal Mayan massages. That particular technique is really used a lot to help regulate the chi, as well as help to get rid of fibroids. So women that have like a bigger fibroid, like they're 5 centimeters or higher. I was even talking to recently a young lady who had a fibroid that was like 10 centimeters big. And that's one of the first things I suggested, that you need to get abdominal Mayan massage to help release. And it's a special technique. So you can't just, it's not like you can just go to a regular massage therapist to get it done. It's a very specific technique, just like lymphatic drainage is a very specific technique. Pelvic floor exercises. You guys had a wonderful conversation with Dr. Joanne Martin yesterday where she discussed this. This is a really big thing, because if your pelvic floor isn't where it needs to be, you're going to have trouble holding your baby, like literally holding your baby in your body. You're going to have trouble having the maximum amount of pleasure you can get when you are engaged sexually. You're going to have issues with prolapse, like bladder, uterine prolapse, all that kind of stuff. So definitely your pelvic floor exercises. Guided meditation and exercise, that's going to be really for your, the energetic part of the traumas, whether it be just talking about the losses or the things that were done to you, and just having an outlet so that that energy does not just sit and fester in your body. I'm gonna skip over vaginal steam real quick, and then hormonal balancing. Yesterday, we talked about hormonal balancing based on pre-pregnancy. So this is gonna go a little deeper into it. And then of course, vaginal steaming, yoni steaming, pelvic steam, whatever you wanna call it, which is my favorite. Love. All right, now for the herbs. Woo woo, my favorite. Y'all, I'm an herb geek. I went on a plant walk yesterday after I talked to you guys. Oh, it was so beautiful. All right, so for liver and spleen, what we want to do is we want to restore and rebalance our liver and spleen using tonic formulas and through food medicine. So remember I was saying yesterday that tonic means that you're going to take it over a course of time. Okay, which means the longer you take it, the longer, the more of a therapeutic effect that it has. Okay, it's not something that you just take one moment and be done with it. Okay, so astragalus, you can take that as a food. I make it in my soup all the time. I like it as a food as opposed to a tincture because it just is super bitter. It's an adaptogen, and what adaptogens do is they literally do that. They adapt to whatever is going on with the body. Whatever's out of balance, they adapt to it. And it has a strong effect on the emotional, physical, and mental body, as well as the immune system and cardiovascular system. Dandelion leaf and or root stimulates the flow of bile, relieves liver congestion, decreases inflammation, and is nourishing, and is also a diuretic. Milk thistle is good for liver and gallbladder health, strengthens and stabilizes cell membranes, stimulates protein synthesis and cell regeneration, as well as production of prostaglandins. We talked about that yesterday. Yellow dot decreases the oxidative stress, stimulates bowel movements, and it also helps to build iron levels in the body. Lemon balm is a nerve relaxant and antidepressant. St. John's wort is a nervine relaxant, antidepressant, and also a nervine tonic. The thing about St. John's wort is that it takes about 6 months before it kicks in. So it's definitely one of the ones that you have to take for a very, very long time. Shiitake mushroom is used to treat poor blood circulation, imbalances with the liver, as well as boost your energy chi. Reishi mushroom is an adaptogen. It's a cardiotonic. It's kidney protective. It's used for shin disturbances, hypertension, a weak heart, and anxiety, and it also enriches the chi as well. And then licorice is an adaptogen. It's good for adrenal exhaustion, PCOS. It harmonizes the testosterone levels, it expels phlegm, and it also clears liver stagnation. So mind you, again, this is like a very, very short list, but it's a good place to start. Cardioprotective herbs for the heart. Hawthorn berry, phenomenal. I love this. I love this. I love this. I love the hawthorn berry. It removes blood stasis, so it's considered a blood mover. It promotes chi, and when you combine it with other herbs like motherwort or angelica, it's used to treat menstrual pain. The will say thing about motherwort though is that be careful using it or having suggesting that people use it if they have a funky situation with their mom. Okay, only because motherwort does exactly what it says. It mothers you. So when you take it, it's like this warm, fuzzy, want to crawl on your mom's lap and be, you know, have your head stroked type of sensation that happens. And if you have a parent or a person who has issues with their mom, that may be a problem. Okay, so just to give you a heads up. Garlic, antibacterial, antiviral, it's a cardiovascular tonic, and it can be used for vaginal infection by putting it into your womb. I'm not saying don't do that. I'm just saying if you decide to put raw garlic into your womb space, just don't go nowhere. Just stay home that night, okay? Linden flower, it decreases blood pressure and supports nervous system function. Reishi mushroom, again, it's an adaptogen, cardiotonic, protects the kidneys, good for high blood pressure, heart weakness, and so forth. And motherwort, it is a nervine. It's a cardiotonic, it's a menagogue, and it has the affinity for the female system. So which means that this herb is specifically for women. Not saying that men cannot use it, but it has a actual affinity for working better with the female enzyme and the female enzymes more so than the male enzymes, okay? It also decreases the stress that's induced by cardiac disorders, helps to relieve cramps, delayed menses, and unresolved sorrow, okay? Adaptogenic herbs. Chaseberry, we talked about this yesterday. I love this herb, love it. Making some, like I have some tincturing right now. And it works on the hypothalamus as well as the pituitary gland, helps to stabilize progesterone levels, regulates the menstrual cycle, as well as it being an endocrine tonic. Ashwagandha decreases stress and anxiety, supports the endocrine, the thyroid, the adrenal glands, and it's also used for people that have a history of recurrent miscarriages. And what it does on that level, it helps to support a weak uterus, okay? Eleuthero, which is also called Siberian ginseng, it's an adaptogen, increases focus, corrects mental fatigue, manages the increased cortisol levels. So understand something about the adrenals and cortisols, okay? If you ever had a job that was highly stressed or you just do a lot, there's a point where you say, you know what, I'm burnt out, I'm tired, I don't know if I'm coming or going, or as we have commonly like to put into practice nowadays is, I'm trying to get my life together, okay? What happens is that you're always in this fight or flight mode and you're over exhausting your adrenal levels, your cortisol levels, which gives you that burnt out feeling. So Siberian ginseng is one of the ones, as a herb that you can use it as a tincture or as a tea, or even as capsule if you feel like it, to help regulate those cortisol levels and those adrenal stresses. Shatavari mushroom is used for PMS symptoms. It's used to increase the fertility, decrease uterine bleeding, and helps to regulate the libido, and is also used for my young ladies who are going into menopause. So like my mom, she's going through menopause, and the blend that I gave her was shatavari. What was it? It was shatavari, hawthorn, reishi, black and blue cohosh. And it was able to kind of like calm down all of her personal summers. And understand, when you go through menopause, you're going through menopause. Like there's nothing that's going to stop it. However, when you use herbs, regardless if it's in this form where you're taking it as a tea or a tincture, you can at least help mitigate some of the symptoms, whether it be the hot flashes, the sweating, the dryness, whatever, okay? And that's literally what it is. It's just making it easier to go through. And then you have white peony. It too is an adaptogen, is used for painful menses, helps with erratic abnormal bleeding. So erratic abnormal bleeding would be you're bleeding on Monday, no bleeding on Tuesday, Wednesday, then you start bleeding again on Thursday with heavy clots, super dark. Then on Thursday it's super light, and then it goes away for like a month. Like that kind of thing is what's considered as a erratic bleeding. I also use it for fibroids, PCOS, and it's a blood and yin builder. Okay. So when we use these herbs in a tincture form, capsule form, tea, or whatever, we use them consistently. And that's the main thing, is using it consistently. It's going to help rebalance our heart, our liver, and our spleen. Now, my favorite part is when you put all these together and you use them for a vaginal steam, there's absolutely no way you can continue living with the imbalances. Okay, let me go to the chat real quick. Yeah, Mimi, I'm right there with you. You don't, girl. I'm right there with you. So much more. So there for you. Wouldn't garlic burn? Okay, so it's uncomfortable. it can burn a little bit, but women that suffer from like a lot of vaginal, not vaginal, a lot of yeast infections or bacterial infections, that's when they would use the garlic, is for those situations. So it's kind of like using boric acid to help kind of get those infections out the way. That's why I said, if you decide to do that, don't go nowhere. Like that's the day you stay your butt at home and put your feet up on the couch and just binge watch something on TV or do work at the house. Don't go out, because you know, you're pulling all those toxins out of your body, and it could get a little interesting on the smell. Chilandra asked about the Mayan abdominal massage. You can actually Google it. Just put in Mayan abdominal massage, and there's a link that comes up, because there's one specific person that actually teaches it for everybody in the country, and she's Peruvian. So go back and just look at that, and I'll try to find the link a little later and put it into the group. Yeah, in the group. Okay. All right. So let's get to how these imbalances look. Well, before I go on, are we clear on the herbs as far as using them to, on a digestion level, to regulate some of these things? All right, good. So we're going to continue rocking on. And the ladies that are asking me privately, I will respond to you privately, okay? Okay. Let me get back to this. All right, so now let's look at what all of that looks like on a physical level, okay? Steaming the yoni. Yes, my favorite thing in the world. The steaming actually works because you're squatting and or sitting over a pot of water. Like when you make your tea and the steam comes up, that's what you want, is the steam. And what happens is that this steam will sit there and break down the volatile oils and the constituents that are in the herbs. That is when you have those herbs broken down like that, and that steam comes up, and and it smells like herbs, it's getting into your body. Okay, your mouth and your reproductive organs are the two most porous places on your body, and that's how the steam gets into the bloodstream. That's how it gets into the womb, so that it can be open. Okay, and accept the constituents of the herbs. Each blend is its own magic, intention, healing, warming the pelvis, stimulating movement and awareness. The medicine of the steam is fully received into the body, warming a cold womb and making space for the reconnection of heart, womb, and the womb and the heart. So let's look at some of the imbalances, okay? So the first imbalance is old residue. So understand, bright red, fresh blood is bright red, fresh, okay? I like to say for ladies that I talk to, everybody pretty much knows what Carmac's lip balm looks like, yellow bottom, red top. If your blood doesn't look like that, if it's darker than that, then that is an indication that you have some stagnation. If your blood is black, mahogany, dark brown, I'm guaranteeing you there's something in there that's not getting a full cleanse, okay? And I'm gonna come out just real quick. I wanna show y'all something. All right, so everybody do this with your finger, okay? So it's your top finger and your thumb, okay? So this area right here, this is your womb. This little line where your fingers meet, that's your cervix, okay? So the only times in our daily situation that our cervix is open is when we were actually having labor or going through labor or during our menses, okay? That's the only time this open. So do me a favor, just open your fingers like this much, like a smidge, okay? When you have old residue, you have clots. So if you have a clot that's the size of a dime, a quarter, a golf ball, it's trying to pass through that little opening. So if you have something that big trying to pass through an opening that small, guess what? It's going to be very uncomfortable. You're going to have cramps. You're going to have pain, okay? So whenever you have, during your menses, those clots and the cramps and whatnot, literally look at what happens next. Look at the blood. Is there a clot behind it, okay? The other part of the pain that you feel is because you have the round ligaments in your back, like the lower part of your back, because a lot of us have lower back pain when we're having those cramps and whatnot. Those ligaments are dry. You know, it's kind of like an overstretched rubber band for the most part, okay? So that's where that pain is coming from. And that usually happens when you have blood stagnation, okay? So dark blood, thick, sticky blood, all that is part of it. And yes, I know for a fact that people like to say the womb is a self-cleaning organ. Yes, it is. But you know what? So is the colon. And you still got to do an enema sometime to get all that shit out, literally. Excuse me, let me curse. All right, let's keep going. The next imbalance that we're going to look at is uterine fatigue. Uterine fatigue is, again, those are the women that say that they have a menstrual cycle twice in 1 month. Not in real life. You're actually only having one menstrual cycle, but what it is that your body is so tired that it's just stopping. You know, it's just like, you know what, I'm tired, I'm checking out, I don't know what you're gonna do with your life, but I'm tired. And that's what happens. When women, and usually that type of imbalance belongs to the woman who has 4 jobs, her self-care is crap, she's taking care of everybody, she's not taking care of herself, she's a mom, she's, you know, a caretaker, she works, she's a manager, like she's constantly on the go, like me. That's actually my imbalance, is the uterine fatigue. But through the use of vaginal steam, I got it under control. So with uterine fatigue, you have the blood vessels and the cervix just giving up. Those are the ones who have menstrual cycles that are less than 27 days. Okay. Let's see. So then the next one, oh, and also too, sorry, with uterine fatigue, those are also the women who have really, really bad digestion. They'll get like bloating after they eat. They'll maybe have like a really wonky diet where they eat maybe once a day or something like that. Like it's really just all over the place. Yeah, and the reason why, okay, so also too real quick, the reason why uterine fatigue is really, really bad if you're trying to get pregnant is because, you know, as we all know, when we get pregnant, it takes the body a minute to get the understanding that there's something there and that it's a baby. So until the body catches up with what's going on, the body's going to try to get rid of it. Okay. Which means for my women who have like a whole bunch of miscarriages, usually within the first trimester, maybe the beginning of the second trimester, it's because you have a place of uterine fatigue. Okay. Your body's just giving up because it's too much work. It's too much stuff going on. It's going to have the baby. So that's your uterine fatigue. Oh, and backing up to the old residue. Women that have a lot of old residue in their womb have a very thick uterine wall. And what happens with them is that the placenta attaches to this wall. And when and it's a fake wall, it's not real. So when their body goes through the process of trying to eject the baby, or the placenta, goes through the trouble of attaching to that wall, it releases because it's not attached to anything real. Okay, it's a false wall. Blood deficiency. This is usually something that kind of follows my young ladies who are anemic, and their blood is going to be pink. It could actually be a little orange at times too. And they have menses that are less than 4 days long, or may even just be absent altogether. And their blood, like I said, can be pink, it can be yellow, it can be a little orange, it can even be clear. Okay, and that's because they don't have enough nutrients to produce the blood. And there's an association with this. This is usually the time frame where some of the women feel like they're not enough. Like they're the ones that are super hyper emotional prior to their menses or during their menstrual cycle. Dampness is women who have excessive cervical mucus. They're the ones that have chronic vaginal infections, bacterial vaginosis, maybe a little bit of trichomonas. They eat a lot of dairy. Their digestion is really off kilter too. They usually have fibroids and a thick endometrial lining as well. Dryness, that's pretty much my ladies who are going through menopause or have severe trauma with their womb, and they just don't get lubricated. And when the womb is supposed to be lubricated, when it's not lubricated, what happens is that it can actually start to have micro tears in your womb, and those micro tears within the tissue will sit there and actually cause opportunistic infections to appear. Excessive heat. 2 people have this. Those are the ones, like, again, my menopausal people, or it's my women where they lay next to their partner at night. Their partner like, oh my God, you're so hot, I can't deal with it, right? These are also the women that have it'll be 30, 40 degrees outside, and they still have a fan on or the window open because they're so internally hot. The thing about these women is that they usually have night sweats, they're having hot flashes, and their blood can actually look a little purple when you see it, or like a neon color. And they're usually very irritable as well because they're always so hot and sweaty. Weak digestion, spleen chi deficiency, poor food combining, lack of good flora, bloating. They can have a blood deficiency as well as uterine fatigue. Okay, those are the imbalances that we are working with, and all of these play a part when we are trying to conceive or just heal ourselves. A lot of times we can adjust a lot of it with diet, but in real life we have to do some other things. We have to work on stuff internally as well as externally to help move it. When you do vaginal steaming specifically, yes, you're sitting over a pot, you have the herbs infusing into your womb, and then what happens is it starts to loosen up anything that's not supposed to be there. If you have dry mucus, if you have retained birth matter, if you have scar tissue, all that stuff over time will start to just go away. Okay. That is the foundation of vaginal steaming. That is how it works. That is why it works. Oh, what just happened? Did I just get kicked off?
Nope, you're here.
Oh, okay, why am I seeing a different screen now? It says I'm viewing bold line as the screen.
Yeah. Do you have, I don't see any tabs on that one. Are you on a Mac?
No,
Okay.
I'm on the Dell.
It looks like your tab just clicked out. Like you just totally, now you're no longer sharing your screen, but it looked briefly like maybe you just clicked out of your tab somehow.
Oh, okay.
You're still here.
Okay,
Maybe.
sorry. Okay, so okay, woo, this is okay. I don't know what's going on. Sorry, y'all. Technical flaw, real quick. But that's pretty much the end of it. I know that sounded kind of quick, and I apologize. I don't want to run too far into Tracy's. I don't know if y'all go to Stacy. Tracy's keynote, but I can take like maybe 2 or 3 questions really, really quick before I let go and allow Tracy to do her awesome thing. All right, so Welvery asks, for a V-Steam newbie, what's the duration of a session preferred? If your menstrual cycle is less than 27 days, 10 minutes each time. If it's longer than that, it can be anywhere from 30 to 45 minutes. It just really kind of depends on how long your menstrual cycle is. Bold Lioness asks, what if you have a hysterectomy and there are no more uterus? Then you can steam as long as you want, however you want, because even though you don't have a uterus, you still have the tissue and you can still get vaginal infections and things of that nature, and you still need to clean the energy of other things or other people out of your womb. Taylor Digby, she asks, how long after giving birth? So what I do is I give steams within 24 hours. Because the thing about birth is that the uterus tilts. So as soon as your uterus kind of hangs like this, and then as soon as you pregnant, it tilts like this. So your cervix is out of the way. So as you go into labor, it does this, and then the baby's out. So once the baby is out and the placenta is out, in theory, the cervix comes back together and closes. The uterine artery that was supplying your womb during pregnancy is closed at that point. So usually I do within the first 24 hours, but some people wait 2 or 3 days. Larica asks, what are the solutions for the excessive heat? Oh, when you start steaming, period, it's going to start releasing a lot of that, as well as making diet changes. Because a lot of times when you have a lot of the excessive heat, you have to look at how much milk, cheese, breads, mucus causing things that you're having to trap it in. And a lot of times you'll find that it's a candida overgrowth that's causing a lot of that heat to maintain what it is. But it definitely, with your excessive heat, you got to definitely do the cooling herbs to help release a lot of the heat that's being trapped in the body. For Rashonda, she asks, is endometriosis and fibroid, should I do both herbs and steaming? Yes. For fibroids, especially fibroids, you got to do castor oil packs, you got to digest herbs, you got to steam, you got to change your diet. It's like a whole big thing. Akila, can DIY steams be as effective as with a practitioner? Okay, so that it gets real tricky, because you have to really do your due diligence in looking at the herbs and the way they're combined. So there is a particular spa here, that a Korean spa here, that has one set of herbs for everybody. If you're in a situation or you're going to a spa where there's only one particular formula, that herb could actually hurt you because it could be too strong for your particular situation. You may need something a little gentler. Understand that there's more than one blend. So I'm not going to say you can't DIY them, but just make sure you're looking at what's there. Okay. At least talk to somebody. You know, you can, there's hundreds of practitioners literally in the country. Just call and ask, like, hey, like, this is what I've realized, this is what's going on. What can you do to help me? Okay, so Atalia, forgive me if I'm pronouncing it wrong.
My question.
Huh? Okay. She says the herbs you use depends on what you're trying to treat, but it will. Okay, trying to treat, but would it hurt to mix all together? Are there? Okay, don't mix all. Okay, so don't mix more than 6 herbs at one time. And you don't do that because you want to make sure you don't have any reactions to anything. And then again, you don't know what you don't know. Okay. There are some herbs that I don't particularly agree with using in the steams, where you will find other women that do. Like there are some practitioners that agree with using marijuana in the steam. I don't particularly agree with that. There are some women, some practitioners that like to use burdock root, or they want to use mushrooms. I don't particularly agree with that, mainly because you have to boil those to get the constituents to come out. And it usually works better if you have leaf and flower. Larika asked, okay, so I make my own blends. My business name is Mystic Mama, MYSTICMOMMA. I'm Mystic Mama 01 on all the social platforms. My website is mysticmamaherbals.com. And for those of you who are local to the Atlanta area, they are sold in Seven Nanda. So for Larika, just go to my website. Actually, no, they're not listed there. Hit me up and we can have a conversation about it. Bowliness, she said mugwort is what they use in Korean spa. Yeah, and they use too much of it, to be honest with you. Mimi, what's your take on the yoni egg and the hysterectomy? So yoni eggs are specifically for Kegel and pelvic floor. It doesn't really do anything else. I mean, I know they say that there's this energetic thing they do with, you know, whether it's a obsidian stone or amethyst, and those are things that are true, but primarily it's for vaginal tone and for your pelvic floor strengthening. So it doesn't matter if you've had a hysterectomy or not, you still have a pelvic floor, and that pelvic floor is going to help you with your uterine prolapse. Okay, so I'm gonna take two more questions. Miss Jasmine, she asked, what about the pearls? My take on the pearls are, I don't particularly agree with having herbs that close to skin tissue, because it will atrophy and necrose the skin and could possibly pull that out. And that's what a lot of people are seeing when they come out. I've used pearls. That's it. And one more question, that's it. Okay, so Crystal, what about women who have had ablation and no menses? Yes, steaming helps with all that. So everybody, thank you for tuning in. Tracy Collins, the owner and founder of the National Black Doula Association. She's coming up next. She's gonna give us crazy mad insight because she is a business guru on this. And just stay around, show her some love. Thanks again. I apologize if I didn't get to your question. Hit me up on social media, hit me up, and I will definitely answer your questions. Peace.